How do you get a proper latch? So one, you want to ensure that you have supported the baby. Unfortunately, I don't have a model, but I'll try and illustrate as much as possible.
Yeah.
So keeping the baby comfortable and their head free. We use the crook of the neck to support the head and the neck, and this hand will support the back of the baby as well as the bum. And it needs to be aligned. The neck, the spine, and the bum needs to be all aligned, right? The baby should be facing mommy. So when you say tummy to tummy, if that's difficult to be able to internalize, think about yourself at a dining table. How do you face? Do you face eating like this sideways, or do you face facing forward? So let the baby face their meal. So baby should always look at you and their whole body. Swallowing on a side position is very difficult, even for the baby. So make sure baby is actually looking at you with their tummy facing completely towards you as well, fully aligned. And then for the face area, the baby's nose should be facing the nipple. That helps you have the baby open up their mouth and tilt their head for the nipple to actually enter the mouth. You want a nice deep latch. If the baby has not latched very well, the nipple may tend to be on the soft palate of the baby's mouth, making the letdown very hard, can cause nipple pain. And as the baby is sucking, you have this constant friction of the nipple against the upper roof of the palate, causing now painful nipples as well. So an improper latch will cause the painful nipples. It will also cause frustration in your baby. They're not latching well, meaning they're making a sucking sound, kind of sound. Their cheeks are going inwards, meaning they're trying to really pull in the milk. They'll get tired as well as cause pain to your nipples as well. And if they're tired, they'll get tired of feeding and actually just come off without actually getting a proper feed, leaving your breasts engorged and painful, and now at risk of issues such as mastitis, which is inflammation of the breast, or engorgement and blocked ducts. So that's why a proper latch is also important. When you have painful nipples, the breastfeeding is quite tedious and discouraging. You might actually decide not to breastfeed, or your feeding will be such a hard journey. You might not want to breastfeed, and your milk supply will also come down.
Latching is something that a woman will hear for the first time in the hospital after you deliver. And also the pressure you get from your friends. Is the baby latching well? Is the baby latching well? And you're there, you don't know, okay, how am I supposed to know that my baby is latching well? And what are some of the consequences? I remember for my own case, when my baby was crying a lot, the first thing I was asked was, is the baby latching well? Because this could be the reason she's having colic. So that is what we are talking today. And Dr. 𝗂𝗂𝗪𝗺𝗂𝐴 is so gracious to us. She's still here. And we are coming to you from 𝗓𝗏𝐾𝐫 Medical Center. They are hosting us today. And please, you need to check them out because they have different specialists, gynecologists, pediatricians. So if you have any of these questions, then you can get in touch with them. All right, so let's get to our conversation. Latching and colic and painful nipples, we are solving that problem for women. So stick here and share with a woman that might need this. And anyone who has a baby, anyone who is planning to have a baby will benefit from this episode. Welcome to the Purity Afya Show. My name is Purity 𝗪𝗪𝗪𝗪𝗪𝗪𝗪𝗪𝗪𝗪𝗪𝗪𝗪𝗪𝗪𝗪𝗪𝗪𝗪𝗪𝗪𝗪𝗪𝗪𝗀h, and Dr. 𝗪𝗪𝗪𝗪 is also here with us. Thank you so much for joining us. For the sake of our viewers who are joining us for the first time, please just introduce yourself, tell us what you do, and how can they find you.
My name is Dr. 𝗂𝗂𝗪𝗂𝗪𝗂𝗪𝗂𝗪𝗂. I'm a consultant pediatrician as well as a child health advocate. I am passionate about breastfeeding, vaccination, early childhood development, as well as nutrition. I'm currently based here in Nairobi.
Thank you so much, Dr. When I gave birth to my daughter, so my friends were calling me to congratulate me, but the ones that have babies, the congratulations was asking me, is the baby latching well? So I had to go to the internet and I'm like, okay, so what is latching? So maybe you can tell us, we can start by defining really what is latching, what is proper latching, what are signs that you're latching well, what are signs that no, the baby, you're not latching well. And this includes even baby positions, how you're supposed to hold your baby so that you can also help them achieve that. Because when they're just been born, they don't even know how to open their mouth. Yeah. So please take us through that.
Okay, so breastfeeding is a common topic that we discuss with mothers, either before delivery or after delivery. And it's very important to get that latch well. As you said, it's something everyone wants to know. Has your baby latched well? Because that will now affect your milk supply, your breastfeeding experience as well. And latching is your baby's attachment to the breast. So how does baby open their mouth? Do they fully open their mouth? And how is the nipple in their mouth as well? So when breastfeeding, we encourage mothers to latch immediately, usually within the 30 minutes after delivery, and this enhances good latching as well as good breast milk supply. So with latching of babies, there are different techniques that we'd have mothers do. Some mothers are comfortable with others are more comfortable with certain holds. So the common holds are the cradle hold, which is the most common that you'll see mothers being taught immediately after delivery. There's a cross hold. There's a rugby or football hold where a mother holds a baby on the side, especially mothers who have twins and want to breastfeed at the same time. Some mothers may prefer to breastfeed lying down, the side lying breastfeeding position. And even for CS moms who are not able to sit up, so sometimes they may opt to have their head on a pillow and have the baby next to them on the side. During nighttime feeds as well, that is also a position mothers can use, or in a way of lying down and still breastfeeding the baby, holding them in a semi-inclined position. So your breastfeeding positions will be based on how comfortable the mother is. Sometimes the mode of delivery. Is it a mother who pushed or a mother who has a CS scar and you're trying to avoid pressure of your hand or the baby on the scar? The timing of the feeds, as we said, daytime and nighttime feeds, you may want to do it lying down. Or if you have twins and you want to breastfeed both of them at the same time. So those are the breastfeeding techniques that you can use. In terms of now the latching, how do you get a proper latch? So one, you want to ensure that you have supported the baby. Unfortunately, I don't have a model, but I'll try and illustrate as much as possible. So keeping the baby comfortable and their head free. We use the crook of the neck to support the head and the neck, and this hand will support the back of the baby as well as the bum, and it needs to be aligned. The neck, the spine, and the bum needs to be all aligned, right? The baby should be facing mommy. So we say tummy to tummy. If that's difficult to be able to internalize, think about yourself at a dining table. How do you face? Do you face eating like this, sideways, or do you face facing forward? So let the baby face their meal. So baby should always look at you and their whole body. Swallowing on a side position is very difficult, even for the baby. So make sure baby is actually looking at you with their tummy facing completely towards you as well, fully aligned. And then for the face area, the baby's nose should be facing the nipple. That helps you have the baby open up their mouth and tilt their head for the nipple to actually enter the mouth. You want a nice deep latch. If the baby has not latched very well, the nipple may tend to be on the soft palate of the baby's mouth, making the letdown very hard, can cause nipple pain. And as the baby is sucking, you have this constant friction of the nipple against the upper roof of the palate, causing now painful nipples as well. So an improper latch will cause the painful nipples. It will also cause frustration in your baby. They're not latching well, meaning they're making a sucking sound, kind of sound. Their cheeks are going inwards, meaning they're trying to really pull in the milk. They'll get tired as well as cause pain to your nipples as well. And if they're tired, they'll get tired of feeding and actually just come off without actually getting a proper feed, leaving your breasts engorged and painful, and now at risk of issues such as mastitis, which is inflammation of the breast, or engorgement and blocked ducts. So that's why a proper latch is also important. When you have painful nipples, the breastfeeding is quite tedious and discouraging. You might actually decide not to breastfeed, or your feeding will be such a hard journey. You might not want to breastfeed, and your milk supply will also come down due to lack of latching, as well as the painful experience that you're actually having. When you put the baby onto the breast, another thing to note is, how does a baby's mouth look? You want the lips all outturned. So once baby opens up the mouth, that is a time when you bring baby close, when the mouth is opened, to be able to get that latch. You want more of the darkened part of the
So you wait for the baby to open the mouth.
Open and bring quickly. Don't start pushing.
You know why I'm laughing? You
Yeah.
push it, and then it's the nipple that is opening the baby's mouth.
Yes, we see that a
Yeah.
lot of that happening just
Yeah.
because of the anxiety, and we
Yeah.
understand.
Yeah.
And I feel we need to encourage mothers to be patient
Mm.
with themselves and with the baby as
Yeah.
well.
Yeah.
For first-time moms, you've never breastfed. For mothers who had this a second or third baby, you've never breastfed this baby before, and this baby has never breastfed.
Yeah.
Be patient with yourself.
Yeah.
Be patient with your newborn. You are both learning each other, and you're both learning this new skill.
Yeah.
So it will take time. Some people get it from the get-go. Others will take a day or two, and that's perfectly fine.
Yeah.
Once you get it, you have a free hand here hydrating with your water as you breastfeed, which is where we'd like to get to. Where mom is comfortable breastfeeding while also doing another task or hydrating, and is comfortable and is not in pain. It shouldn't be a painful experience.
Yeah.
And there's a lot of anxiety around it, and I encourage mothers to come in so we can support them to make it successful.
Is there a point where the baby doesn't know how to latch, for example? I know when they are born, they definitely will not know. So is there a way the baby can be trained? I don't know whether there's a word like that because it's just a newborn on how to latch well, because some of us have really struggled to getting, especially when they are newborns, they don't know how to open their mouth. So how do you get your baby to latch well?
Babies are born with reflexes, and the important reflexes for breastfeeding are your rooting reflex and your sucking reflex. Your baby is born knowing how to suck.
All right.
They are born knowing how to open their mouth when the nipple is nearby. They can also smell the milk and smell mom. So that's why when you put them next to the nipple, they open their mouth because it's a routine reflex. When you touch a baby's mouth, even when clothes touch them, they open their mouth. That is what you're trying to stimulate, and use that reflex to get baby to actually attach to the breast. But as I said, it's a learned process. So when you do it frequently, and sometimes I even tell mothers, for today, let's do it every 2 hours. I want the two of you to practice. And practice always makes perfect.
Yeah.
So when you practice several times, you get the hang of it. Remember, it's something that it's not a inborn thing. You're both learning each other. The reflexes are there, but now the support and the practice is what makes you better and makes it a seamless journey.
So let's now address the issue of the consequences of not latching well for both the mom and the baby.
Okay, so the unable to establish a good latch may affect breastfeeding as well as breast milk supply. So when we talk about mom in terms of poor latching may cause painful nipples and cracked nipples, which makes it even harder for her to breastfeed and even discourage her from breastfeeding. Every time she thinks about breastfeeding, it's a painful experience. The milk supply even goes down because she doesn't actually want to breastfeed. When you have cracked nipples, you now may get risk of infections. One, you may have engorgement of the breast leading to mastitis, and those may come with other complications, including fever, and at some point, mom may need to take antibiotics just because of poor latching techniques, right? Oral thrush can also come when you have poor latching and reddened breasts or rather cracked nipples. You get fungal infections on the breast that you can actually transmit to your baby. You've seen babies who have some white on the lips, on the tongue, and mom may also actually have this soreness every time she's feeding or even after feeding on both nipples due to oral thrush. For the baby, a poor latch will get them tired. At some point, they may lose interest and actually not want to feed. They may have low sugars because they're not feeding well. They may have poor weight gain as well because as well as not latching well, poor milk supply, their weight gain actually goes down. So your baby is frustrated and will end up not gaining the weight as they should because they're not getting adequate milk supply and not latching very well. So that's why it's very important to establish a good latch.
And there are babies who refuse to breastfeed. I've had mummies saying that my baby has completely refused to breastfeed, and so they have to, I don't know whether they refuse the milk itself or it's a problem with the latching, they're frustrated. But we have cases where the baby doesn't want to breastfeed, and even when you try to pump, they still don't want that breast milk. What could be the cause for that?
It's very important to identify what is a cause for baby not latching onto the breast or what is a cause for the baby not wanting the milk. So those could be very different or the same. A baby may refuse to breastfeed because, as we said, we're not latching well, we're not supporting the baby's head well and getting a good technique. The baby may have an illness. As we said, oral thrush may cause some discomfort and fussiness in the babies and they refuse to actually latch. Your breast could be engorged, making it very difficult or very full, making it difficult for the baby to latch. Different sizes of nipples, especially the challenge would be with the inverted or flat nipples. It takes a baby a while to learn how to latch from this breast. Not saying it's impossible, it's very, very possible, but it will be difficult for them to learn. Poor milk supply, maybe caused by maternal diet, mom's anxiety. So poor milk supply may also cause this interest in the baby not latching very well. We've talked about infections, but also if your baby is sick, if they have a flu, the nose is blocked, or they have an ear infection, when they're sick, they'll generally not want to feed. So once you're able to identify these factors and you're able to deal with them as they come, mothers may actually use a different perfume or lotion or have a spicy meal that day that changes the taste of the milk. And the baby now is averse to the milk that they're getting. During menses or pregnancy, mom may not know they're pregnant, but the milk taste will change for the baby. When you're talking about bottle feeding and the milk and the baby refuses, this is milk that has been stored over a period of time, especially like when you put it in the freezer, these enzymes are still working. So the milk smells and it tastes different. So you might find your baby averse to that smell or taste because of just the natural changes. Not saying that the milk has gone bad or it's unsafe.
Actually, mine refused. When you store, she will not take. So she just want the fresh
milk. Yes, fresh is always best. But sometimes when you pump and you keep for them and you have to leave the house, they are saying this. It does taste different. So some may actually refuse. It's not that the milk is bad. Your milk is bad. It's just that it smells different.
All right. Thank you so much. As we wrap it up, maybe we can correct the nipple crack because now a wrong latch has happened and a woman is having this serious cracking. How do they correct that so that because I remember I experienced that and so the crack, but then your baby needs to feed, so sometimes you find yourself still feeding the baby while you're still in pain. How do you correct that?
That's very traumatizing. To breastfeed from cracked nipples, it's an extremely painful experience. There are sometimes you may want to just give yourself a break. You can pump for a few feeds or even a day or two. So you pump your milk, your baby's still getting your milk, but now from the bottle or a cup and spoon or a different sort of form of feeding, and give your nipples a break to heal. And when you're using the pump, you'd like to use the lowest pressure or suction pressure to avoid injury or further injury to the breast. If you're comfortable, people think it's hard. It's harder than it looks. Hand expressing is actually a very, very good method of doing the hand expressing to help with healing. Once you get the hang of it, I've seen mothers do it seamlessly compared to with a pump.
Me too, I've seen and I'm just like, there are moms who don't just like pumping, others like, because for me, I'm that mom who doesn't like pumping. So each time I'm thinking I'm pumping milk for my baby, I'm usually stressed the whole night because I know I have to leave and I have to leave some milk. So but you're encouraging us that once you get a hang of it, then it becomes very enjoyable.
It is. So hand express for a few feeds or a day or two.
I think I will learn that.
Let it heal. Remember, your milk is also a powerful tool. It has healing properties. So you can actually express a bit of the milk, apply on the nipples, let it air dry before you put on your clothes on. So it does help with healing. Use over lanolin based ointment or cream to apply on the nipples. That's safe for the baby. Ensure you read the insert that if you do need to wipe it off before breastfeeding or is it safe, are actually recommended, especially during the first week. The first week it's very common to have the nipple soreness. After that, now we need to address, is it a proper latch technique that we're dealing with? But it's always good to have this to keep the nipples moisturized, and then find out, could it be oral thrush? Are you and your baby having a fungal infection? And if it's that, we need to treat both baby and mom to ensure that that is resolved, so you don't have that soreness throughout.
All right, Doc, thank you so much. Indeed, if you're learning from this episode, you need to like, you need to subscribe, you need to share, because Dr. 𝗪𝗠𝐻𝐾 is still with us for our next episode. We shall be talking about baby vaccines. We'll also talk about the weaning, the schedule. You need to stick here and you need to share this with a mom who might need this. Thank you so much for staying with us. I am 𝗕𝗿𝗄𝐪. I'll see you in the next one.